Hello there, a very good evening and welcome to another edition of Newsline Live, coming to you live and direct from our Newsfirst studios here in Colombo. Of course, it's a known fact that Sri Lanka is going through unprecedented times, and it's important that, of course, we take action to prevent any further harm to our country, to our loved ones, and even to ourselves. And to take this imperative action, it's important that we stay informed. And we here at Newsline are here to do just that. Today on our show, we've got Dr. Nihal Abeysinghe, former Chief Epidemiologist from the Ministry of Health, and we're hoping for a productive conversation on how the general public today, how Sri Lanka today can face these unprecedented challenges. A very good evening, Doctor, and thank you very much for taking time off your busy schedule. Doctor, first things first, the people in the country are getting, well, a variety of messages, mixed messages on the current situation of the COVID-19 pandemic in Sri Lanka. People in Sri Lanka know that it's bad to a certain degree with, of course, the spread of the Delta variant. But, Doctor, in your opinion, in your expert opinion, what truly is the real ground situation in Sri Lanka right now?
Sharlan, first week of July, we had about less than 1,500 cases a day. And it was less than 50 deaths. But now it has doubled. Now it's about 3,000 deaths a day, reported number.
Cases, you know?
Yeah, sorry, 3,000 cases per day as reported, and about 100 deaths per day. So this means, it's the situation from second week of July to this second week of August. It's really has doubled the number of cases and also the number of deaths. So that's we have to take it as alarming, because this is not only relevant to Sri Lanka. The whole world, except New Zealand, I would say, whole world is affected by this third wave and the repercussions of Delta variant. So this is what we are experiencing in the world. And it's not only here, it's really in this region. It's Myanmar, it's Thailand, it's Malaysia,
Indonesia.
It's Indonesia. So all countries are suffering, and most of these the countries are almost collapsing their health systems. So we need to be cautious, and we have to take all precautions to prevent disastrous situation.
Well, Doctor, the Association of Medical Professionals had sent a letter, of course, to the authorities highlighting many of the issues that you pointed out right now, and the alarming rate of the spread of the Delta variant here in Sri Lanka. They also said that hospitals in Sri Lanka are at almost full capacity. And Doctor, there were some images that were circulating on social media and other platforms of people sleeping on the grounds, hospitals at full capacity. Some patients even put out on the gardens of these hospitals because they don't have enough space to accommodate. But of course, there is an issue with misinformation and disinformation spreading here in Sri Lanka. Doctor, are these claims true? Is the hospital or the medical capacity in Sri Lanka been reached?
Sharlan, all these 1.5 years, there were some beds allocated in the major hospitals for COVID patients. I think this increase came about last 2 weeks, and definitely when the large number of patients came into the hospitals, so that the allocated number of beds were not enough. And then there was a crisis situation during that particular period. And now I think the hospitals are allocating more beds. So therefore that situation is now getting eased. But that doesn't mean that the number of patients coming to the hospital is less. They are coming more, but the hospitals have arranged more beds for them. So therefore that particular situation is now, I think the hospitals are managing, and this was basically in Kalubowila and Ragama hospitals, and as the social media and the news reports came. As far as we are concerned now, I think the hospitals are adjusting. They are closing I mean, several other wards, and then accommodating the COVID patients now. So it's not that we have solved the problem, but we are accommodating the patients, more patients to the larger hospitals. So that's how it has been.
Doctor, on the supply of oxygen and the availability of other medical equipment required to treat COVID-19 patients at hospitals, what is the current situation?
See, now, I mean, most of the patients, at least 50% of patients who are getting admitted to the hospitals, they need oxygen. So the consumption
50% of patients,
yeah, I mean, around 50%, yes. So consumption has gone up. I think so far it is manageable, but I mean, soon if the patient load goes up and the severe patients load goes up, certainly that there will be a situation that we will have problems. So we need to manage the current situation. I mean, without thinking anything else. If we manage the current situation well, perhaps that we can manage what is going to happen during the next 2-3 weeks.
Dr. Nihal Abeysinghe, I'm going to pose the million-dollar question to you right now. There has been much debate on this question over the past few years since COVID-19 hit Sri Lanka. Should the country go into a lockdown? Should we continue like this?
Sharlan, now we are in a situation that we need to consider seriously about locking down or complete restriction of movements, I would say, because I think Sri Lankans will not perhaps understand what the lockdown is, because the experience is in the last 1.5 years. So perhaps it is people who know here in this country is curfew, right? So maybe that we need to consider at least for 2 weeks, right? Because maybe we can include 4 weekends, I mean 4 days in the weekends. So 6 working days at least, and then make it 14 days. So that's the best way that we can handle this situation, because if we don't handle the situation now, and if we keep it for the last moment as the last resort, we will have more deaths and we will have more cases. So therefore that we need to consider now some as much as possible some restriction of movement. Maybe we will keep the essential services on and limited numbers of staff even for the essential services, and then at least some as much as possible restriction of movement for 2 weeks, and then monitor the situation and see that what areas can be released from the grip, and then and make sure that we will minimize the number of deaths among the at least elderly, because even now more than 75% deaths are among above 60 years of age. So that means we haven't, I mean that part we haven't addressed well. We would have addressed by our vaccine campaign, but we haven't done it. So therefore that we need to protect the elderly population.
Doctor, when you say lockdown, complete restriction of movement, could you elaborate on that a bit as to what you would recommend to the government?
Sharlan, because actually the situation is so bad, we need to make sure that people will not move around. Because when people see that the middle class goes in their cars and then they are on the roads, and then they see that those who can afford to travel without any trouble, they see the others feel coming out, and they need to go for their routine work, and the officers are working, business are open, so I mean naturally people tend to come out. So unless we have some sort of restrictions, I mean it's very difficult for people to make it self-restriction, because it's very difficult for people, because people see that others are walking around, So they tend
And
to...
also they have mandatory commitments,
Yes.
be it their workplace,
Yeah.
be it other commitments. When the country is open, they have to go for that.
And Sharlan, in our culture, you know, when there is a wedding and invitation comes, you feel like attending. And then in a funeral, that you think that you have to go and respect the one who has died. All right? And then when you are invited for a function, you feel like going. I mean, that's our culture.
Dr. Abeysinghe, I just received an update on the number of confirmed deaths today, and it's 118 COVID-19 deaths. Day after day, we are reaching new record levels, new record number of deaths from COVID-19 in the history of Sri Lanka. Doctor, this whole debate between whether to go for a lockdown or whether not to go for a lockdown is, on the other hand, is fueled by the economic crisis that Sri Lanka is going through right now. The government says they don't have money to well, assist everybody or provide another 5,000 rupee concession or an allowance to all families in the country so that they can just get by for this 2 weeks that the country is being placed under lockdown. Do you think you're being inconsiderate to that fact when you recommend an outright, complete restriction of movement across the country?
Sharlan, now just you said that 118 deaths. So even if we take 100, the month of August will have 3,000 deaths. All right. So you can remember that in last October, when we had the second wave, we had only 13 deaths during the earlier period, and now we have more than 3,000 deaths.
Or we will have.
Right. I mean, if we have, I mean, now already we have about more than 3,000 deaths in the last
total
1.5 years, right? So if we allow this to continue, we will have 3,000 deaths alone only in the month of August. So I think we need to prevent this, and we have to take it very seriously. We need to protect our population, and we have to prevent deaths. So that is why we are, specifically the medical profession in this country, what we are urging the government, this is the time to take as much as possible the strategies that we need to adopt. We have to adopt now rather than waiting till the at the end of next 2 weeks or 3 weeks, then we would have lost another 3,000 people.
Doctor, if we take measures right now, will we be able to prevent this 3,000 deaths taking place this month?
No, it will be, even if we stop movement now, we will have this number.
3,000 deaths in the month of August?
Yes, but at least if we can stop, we can stop beyond month of August. Then because we can get down the numbers, down, and then our deaths also will be less after that. So that is how really we need to think about it, and then plan for it.
We'll cross over to a short commercial break, but on the other side of this commercial break, we'll be speaking about the vaccination program in Sri Lanka. Like I mentioned at the beginning of the program, there's a lot of misinformation and disinformation also spreading on the vaccines that are available in the country. This may have even deterred you from taking certain vaccines, but we'll get to the bottom of this after this short commercial break. Don't go anywhere. You're watching Newsline Live.
Newsfirst, Newsline. Newsfirst, Newsline.
Welcome back. You're watching Newsline Live. We're in conversation with the former Chief Epidemiologist of the Ministry of Health, Dr. Nihal Abeysinghe. Just like we promised you before the commercial break, we'll be speaking about the vaccination drive in Sri Lanka. Dr. Nihal Abeysinghe, despite the current situation in the country with the spread of the Delta variant of the COVID-19 virus, and also the economic woes of the country to go along with it, something that we can at least be proud of is Sri Lanka's vaccination drive. We can see that the military is also involved in this. The vaccination drive is being conducted across the island. How do we fare with the rest of the world? Could we do better?
Sharlan, comparatively Sri Lanka has secured a reasonable amount of vaccine. Though we started late, we have given first dose of vaccine for a larger population, more than 80% of the country. But unfortunately, we have not been able to give the second dose of vaccine, which is a must for, at least for the Sinopharm vaccine. So therefore that, the immunity that the people have is not adequate enough to face this particular way, right? Maybe that with time, we will have our vaccination coverage increase, and so far that we have achieved only about 25% of second dose, coverage throughout the country, but there are districts less than 10%. Only Colombo has 55%, Gampaha 45%, and Kalutara about 35%.
First dose vaccination?
First dose, no, second dose.
Second dose, okay.
First dose, of course, we have all reached, more than 85%. Yeah.
Right.
So, but because that we haven't reached this second dose of vaccination, that reasonable coverage, now the people are vulnerable and people might get infection. Even there won't be deaths among them. People will get the disease because these vaccines will prevent the complications and the deaths. So therefore people will tend to get the disease, and those who are unvaccinated so far and also with only one vaccine dose, they might succumb to deaths. That's how this we see in what is going on now.
Well, Sri Lanka is known to have great vaccination programs, especially for various other diseases besides COVID-19. We have one of the best child vaccination programs in the world. Why weren't we really able to extend this to the adults when the pandemic hit?
Sharlan, yes. I was there in that particular unit for 27 years in the epidemiology unit, the expanded program on immunization. We have the best immunization program in the world, I would say, compared to any developed country. But unfortunately, we had a very good plan, but we were not able to implement that plan. And how, initially we had a very good vaccination program for the frontline staff, the health workers and the forces, right? But when we went vaccination for the community, I think some of our specialists, or maybe the government politicians or the government, they thought that we can reduce the spread of infection by giving at least one vaccine. This was the the knowledge that we had throughout the world, and countries like Canada used it because they secured large quantities of vaccine, and then they initially vaccinated the large number of people with the first dose, and then they went for the second dose. But in our country, we secured not that much of vaccine at the beginning. But we only concentrated on the western province, mainly at the beginning, and then we gave first dose, and then we went to the other areas. So therefore that we were unable to complete the vaccination in at least in one area to see that how the effect is. So now
focus on the adults for that.
Actually focus on the adults, because we were focusing on the 30 to 60 or above 30.
Right.
So that was the mistake. And if we really focus only on adults first, and then come down with 60 to 50 years, 50 to 40 years, 40 to 30 years, and looking for comorbid conditions.
Right.
The people with comorbid conditions like non-communicable disease and the cancers, right? So then we would have protected the people who are dying now.
Dr. We're in the final few minutes of the show. I've got many questions from many of our viewers out there. Of course, very important questions, but we can only accommodate a few in this time period. Doctor, people with allergies to various things find it a bit difficult to obtain the vaccine. What is the status of that? Like some vaccination centers don't really have the necessary facilities to treat them for an allergy if it does start acting up after the vaccine is administered. How can this issue be addressed?
Yeah. Sharlan, for this purpose, I think government has opened vaccination in hospitals.
Right.
And even the National Hospital of Sri Lanka, they have opened that, the vaccination in the hospitals. And not all, but people have problems. I think they should go to a hospital, and if they have any allergy or if they are suspicious about whether they should take the vaccine or not, any suspicion, I think they should go to a hospital and take the vaccine now that facility is available.
Doctor, one final question that I would like to pose to you is the vaccines that are available in Sri Lanka. We have the AstraZeneca, we have the Pfizer BioNTech, we have the Sinopharm, we have the Sinovac. Is there any discrimination between these vaccines? Is one better than the other? Or because some people, they say, we don't want to get this vaccine, we will wait until this vaccine comes to the country. Is that a proper mindset to be in given the current situation in the country?
Sharlan, I think this came, people started thinking like this because the developed world was basically, they were using the Moderna and Pfizer vaccines. And then, at least in early stage, it was AstraZeneca. But we could not secure that type of vaccine at the beginning. So therefore that we looked at, the Chinese vaccine, Sinopharm. So, actually, if we look at our vaccination program, all our vaccines have been, given the WHO emergency use list registration.
Approved.
Except Sputnik, right? So, Sputnik, of course, our NMRA gave the approval, but WHO has not yet given the approval for this emergency use list. But the other vaccines, including Sinopharm, is WHO has approved, given this emergency use list approval, right? So therefore, these, I would say, these vaccines, the purpose of vaccination is to minimize the complications and prevent deaths. For that purpose, all these vaccines in use are very useful, and I think, whenever we have the opportunity, I think we should grab the opportunity to get the vaccination, whatever it is available in the country. You can argue because Sinopharm might need 2 doses of vaccine to, get the full immunity.
Right.
But Moderna and, Pfizer might have a reasonable immunity with 1 dose of vaccine. So that perhaps the discussions going on, but I think as we have a reasonable amount of vaccines in the country, I think we all should get our vaccination completed as early as possible to prevent at least the complications and the deaths.
Doctor, I will squeeze in one final question for, of course, the benefit of our viewers. Recently, the government said that they are focusing their attention on providing a booster shot to the general public. So when this booster shot does come to Sri Lanka, should the adults be the first to get this? How should it be rolled out? Or is this really a viable plan?
Sharlan, the whole world is debating on this issue because when some countries don't have even 10% of vaccine for their population, whether it is ethical to have the 3rd dose, right? So even WHO is very seriously have taken up this, and then discussing with the developed world and advising not to go for the booster dose or 3rd dose, because there are so many people who are, who has not even got the 1 dose of vaccine. So if Sri Lanka can complete early our 2 doses of vaccine, then we might have to consider, if we consider that, the priority should be given to the health staff and the elderly population. So there is no doubt about it. But for the moment, I think it is not ethical to consider a third dose of vaccination, because many countries in the world I mean, they are struggling to have even a single dose.
Doctor, the government has easy access to patients who are in hospitals, for other complications, other reasons. Why isn't the government vaccinating these people?
Sharlan, the people who have come to the hospitals, they have come for various reasons. I mean, it's very difficult to, identify whom to be given and whom not to be given. It's a lot of work. And then at this moment, you know that a certain number of health staff also has got affected by this the epidemic, right? So therefore, that the hospitals also has a staff shortages. I think this is not the time to look at the people who are coming to the hospital for vaccination, but certainly the non-communicable disease clinics like diabetic clinics, the hypertensive clinics, those clinics can be used to vaccinate these people with comorbidities. That opportunity is there, and I think we should use that opportunity, but not for everybody who is coming to
hospital and getting admitted for other diseases.
Yes.
Thank you very much, Dr. Nihal Abeysinghe. Of course, we wish that we had more time. However, our time on Newsline today has come to an end. Once again, thank you very much, Doctor, for joining us on our show and educating the general public during these very trying times. Of course, as Dr. Nihal said, it is very important that you restrict your movement as much as you can. Stay at home. Don't leave unless you have to go out for some essential purpose. Take care of yourself. Follow all health guidelines that have been issued by the government. Stay safe. We will come out together from this pandemic as one country. Take care and God bless.